What things will I learn in the BRT Level 1 and Level 2 certifications?
Before we can add the advanced skills on top. Now, the last question that we get is, well, what's taught in your Level 1 and Level 2 BRT certifications? Well, in that Level 1 brain reactivation therapy certification, we actually teach what does the normal healthy brain look like when it's functioning. Then we teach what does it look like when things are going haywire or you're not well. Then we teach this is how it's restored, and finally we get into here's some of the strategies you can use to start to restore that. So you basically get that foundation in BRT Level 1, and it goes a little more deep than that, but BRT Level 2 is where you really get advanced. Here's where we're going to bring in and start to say, now that you know the foundation of what you need to do, what healthy looks like, then all of a sudden we can take it and we can start applying it to the different therapy modalities. How would I do this using a psychodynamic approach and help reactivate this part of the brain? How would I do it if I'm using EMDR or if I'm using DBT, or fill in any of your favorite therapy types? What is happening if I approach this way or that way? What happens if I skip this step? And so you get a general overview in Level 1 of what does healthy look like? What does the general approach look like? Level 2, we now get into the weeds, the meat and potatoes of it, where we're applying things down to that expert level and understanding when to do it so that it just feels seamless for them. And it really makes a difference for our patients when they come to our providers and say, I have this seminar, I'd like you to go through it. The providers already know this is a manualized treatment. We're going to go through the PTSD seminar, or whichever one they're choosing, the sleep seminar, and then they understand how to use individual tactics and techniques in order to reactivate that part of the brain, help them get unstuck, help them get moving. And so that's what Level 2 really is. And so those are the three things, and we consider ourselves blessed to have.
Is BRT meant to replace other therapy types like EMDR, DBT, CBT, equine therapy, sand tray, or any other therapy type?
And that is, many times when there's a new therapy type that comes out or there's education, the people want to go ahead and replace all of that education and that knowledge and that experience that the people have already obtained through all their efforts. And my answer to that was, why in the world would we ever try to replace any of that? Instead, my answer has always been, when you're learning BRT or you're coming to University Elite, bring all the good that you have and let me add to it. Let's take somebody that's already good or even a great provider and turn them into an elite provider. And so when it comes to it, the first question is, are you going to try to undo everything I've learned? The simple answer is no way. Let's add to it so that you take everything you know and we give you even more additional tools. And then the second question inevitably from those providers becomes,
How do patients find me after I become BRT certified?
how do you add to it? Well, there's a few different ways that we do that. First, we have established a listing service where providers can come on and get listed with University Elite so that patients who are really desiring to dig in and get to the root of what's causing their struggles and start to attack that root directly, there's a single database full of them to where a patient can come in and say, I want to know more and I want to get somebody who can work with me using the resources. And so that's the first thing we do, is that listing service. Now those resources we said,
What benefits do I get as a listed provider at University Elite?
Now those resources we said, once my providers are registered in the database, well, they get additional things. They actually get a personal access code that they give their patients, and this personal access code is going to do two things. Number one, the therapist is going to get access to all the seminars that these patients are obtaining, and that way they'll know when the patient calls up and says, I want you to go through this with me, they'll be able to say, I understand what it is, I understand my role in it, I understand how to help you. And then additionally, as soon as they register, any patient they give their access code to gets the sleep seminar for free. Once the provider who is registered in the database gets Level 1 BRT certified, we actually recognize that is the BRT certification is what allows you to help the patients the most. And so if you're Level 1 certified, we're going to give your access code 25% discount for any patient that uses it to any of the seminars. You get Level 2 certified, it's a 50% off of any of the products that we have here. And so say you have somebody that's going through the PTSD course and you're Level 2 certified, at checkout they would put in your code and automatically 50% is removed. And we do that because that allows those patients to receive the best care. We know that they're going to get the most out of it, and we want to promote those people that are going to really help their patients' healing.
Will I get education credits for getting BRT certified?
And that is, and I guess there's one more benefit there, which is anytime people do the certifications, they also get continuing education credits to fulfill their training requirements for that year. But
Is the BRT certification course designed to teach the basics of therapy and how to approach a patient?
The big thing that is an assumption there is this is not giving the baseline training. This is more of the advanced training. You need to have received the baseline training in your social work degree or your counseling curriculum, those type of things. You've got to bring in the basic skills before we can add the advanced skills on top. Now,